guys, good morning and welcome to another edition of the Weekly Roundup. Today is Tuesday, May 11th, and we're all coming to you via Zoom. And we have a pretty good show for you tonight. We have a guest today. We have the former MTA Chief of Department and Putnam County Sheriff hopeful, Kevin McConville. And guess who's with me today? As always, Sergeant Jerry Kane is with me today, and he's going to take you through the officer down page information. Jerry, do what you do, man. What week is it and what day of the countdown?
Yeah, so we are at day 132 or 133 of being held hostage by bail reform here in New York State. It's, of course, in the middle of this COVID stuff, it's not helpful. Burglaries are going through the roof. Commercial establishments are being burglarized like there's no tomorrow. Perpetrators being arrested and released right from court to go back out and burglarize again. It's not an optimum situation for the tax-paying people of New York State. Not good at all. But before we kind of dive into everything, there's a lot of COVID stuff we want to talk about, bail reform, and general stuff about that our police are facing these days. It is Police Week. If COVID hadn't come, Inside Blue 360 and the Weekly Roundup would be coming to you from Washington, D.C. right now. But we're zooming in because of COVID. Right now, as we sit in May, 3 officers have died in the line of duty as per the Officer Down Memorial page. That's odmp.org. It's a great site that memorializes all of our nation's heroes who've made the ultimate sacrifice. This month, so far, we've had Police Officer Jason Knox of the Houston Police Department. Officer Knox died in a helicopter crash. We've had Police Officer Michael Mosher of the Overland Park Police Department in Kansas. I've been to Overland Park. It's a very nice town. Officer Mosher was in uniform and off duty when he saw a hit-and-run accident. Followed the driver to a location in an attempt to make an arrest, and the suspect saw him get out of his car, and a gunfight immediately commenced, and the suspect and Officer Mosher died. We grieve Officer Mosher here. We don't really care about the suspect. And the most recent one, and there are others, but the most recent one at ODMP has certified is Sergeant Lionel Martinez of the Alamo College's Police Department, also in Texas. He died of COVID-19, like a lot of officers have died this year. We grieve for them all, and we remember them all here at the Weekly Roundup, and we honor their sacrifice. Again, that's odmp.org if anybody wants to go there.
All right, Jerry. All right. So let's see. Did you hear about, I think it was in Texas, and I have to say, I'd be online there too, getting a haircut, but evidently somebody disregarded.
Yeah, right.
Disregarded the order there, and she just kept going, and they locked her up or whatever, and they're giving her citations. What do you think about that? What do you think about it? I need a haircut.
I'm a little conflicted about all of this stuff where the cops are being put into the middle of enforcing the social distancing. Essential businesses can stay open, but the non-essential businesses close, all this stuff. I don't like to see police have to do this kind of social work, especially the social work that's fraught with all kinds of risk, because you're either, it's like, I don't know, it's almost like Lord of the Flies, what's going on right now. You're either with open up, everybody go, 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 or you're with close it up, stay safe. And I do want people to stay safe. I mean, one of our officers that we just mentioned died in Texas of COVID. And I don't want to see any more cops die of COVID. I don't want to see any nurses die of COVID, or firefighters or paramedics die of COVID, or anybody in general for that matter. But I also understand that people are going broke. They're starving. They can't put gas in their car. They can't put food on their table, and they're getting desperate. If you think back
Right,
to your own
right.
career, Michelle, all the people you locked up in the Bronx, all the people I locked up in Manhattan, how many of them were driven to crime by some kind of economic need, right?
Oh, all of them.
Right. So
Yeah.
now we literally have 100 million
Oh,
people
yeah.
that are being driven by economic crisis to do things they normally wouldn't do.
Oh, of course, of
Uh,
course.
and it's a bit of a conflict, right? When they're emptying jails because of COVID,
Right.
we're letting sexual offenders out, we're letting burglars out, we're letting robbers out, we're letting car thieves out, but we're locking up the wash and cut lady from
Yeah.
Texas,
Yeah.
who was the salon owner. Well, it seems a little
Right.
crazy, right?
Yeah.
Uh, I don't know what the answer is. I really don't. I mean, this is, I've got none of us have any experience of going through something like this. A lot of this
Mhm.
stuff is, uh, comes out of a textbook, and they think that this is the way it should be. I don't know. I really don't
Mhm.
know what the answer is.
Right, right. Well, I mean, the big thing is that we want to keep everybody safe, and you know, and anybody who comes in contact with anybody, that goes, for the cops and the EMS guys and all that stuff. And I think that as far as the jails and stuff like that, honestly, if and we could talk, I want to talk to our guest because Kevin McConville, he's running for sheriff in Putnam County, and and he's probably got very good answers for us. And you're the former chief of department of the MTA.
Yes,
Um,
Michelle.
that's actually pretty cool because my niece is an MTA cop. But
Oh, that's great.
yeah, yeah, yeah. But
Making a contract here on Inside Blue 360. I like
no, I believe me, there was probably we already took care of that. So anyway, that's a great job. That's a
It
great
is.
job. And everybody should go to CrossFit and find people, because you can sometimes find really good people who know people. And it's amazing how this department and other police departments can merge together and actually help each other out. That's really the most important thing. But anyway, this is the one thing, everybody is talking about the jail reform, releasing people. And the one thing people have to remember too, these are people that are locked up in jail. They're not in prison. And that's a big difference, because the people in prison that they're talking about, possibly releasing, that's a different story. Those are people that are maybe a little bit closer to the end of their sentence, and for the most part, it's crimes that maybe they made 90% amends of. But the jail thing that's the thing, because they just feel like, well, I didn't get locked up. So it's like when you get a parking ticket, you almost want to leave it there because you're like, well, I'm not going to get another one, am I? So I
That
mean, what do you
you're right.
think? So let's kick it off to our guest here, Mr. Kevin McConville.
Thank you. Thank you very much for having me on the show, and thank you for the opportunity to address your listeners. More importantly, thank you for everything you do, and remembering those police officers and first responders that have made the ultimate sacrifice. That's very, very much appreciated on behalf of everyone. More so, I hope that you guys and current first responders are taking really good care of themselves and using universal precautions. Although there is no silver bullet to this thing, we hope that they're doing everything to keep themselves and their families safe. As far as the bail reform, I think that's a bit of a misnomer. It should just be no bail, no crime. I mean, that's where we're kind of headed. It doesn't matter what people get locked up for; they're out a couple hours later. And we've had a couple of instances up here in Putnam County where people have been arrested. An individual from out of state was arrested for stalking someone, and I think within 7 days later, he was rearrested for the same crime. He tried to take it up a notch. So it clearly isn't working. If you look at the intent, it seems that the intent was far greater than minimizing bail, and the intent was not to put people in jail. And those same people that you're putting in jail, unfortunately, they're the recidivists. They keep committing the same crimes because you said there's underlying issues. And as a society, we don't treat that. We don't treat the underlying issues. We bring, law enforcement does their job, and Jerry's point is really good. We shouldn't be the social distancing police. we get criticized enough for enacting and enforcing the laws of the state and the cities that we work in. And now they're taking us to task for social distancing. So you really can't win either way. And you know what? I don't think anyone that went in this profession and chose it as a career decided they wanted to win. They just wanted to make a difference, a positive difference on as many lives as they could possibly effect.
Right. And now too, that's the other thing. A lot of people don't realize that the bail reform issue is is just something else that's dumped on the police, because now not only does it, I laugh at Jerry because I worked in the Bronx my whole career, and so it was like a whole different world. And you used to see the guys getting released right then and there, like they'd be walking out from the daisy chains. And
Right.
but and people don't realize the impact. And again, like you pointed out, it's the economy. You have people that this is how they make their living. But now you have people that are trying to survive, breaking into places. Like they said they were breaking into a couple of like food establishments and taking, whatever one's closed down. And that's another thing, everything has been dumped on, any police department, as
Right.
far as social distancing and everything else.
Yeah, it's this virus, this pandemic has, adversely impacted everybody. You can any layer of society you can talk about, it's had a direct and harmful impact on them. And if you take people that probably wouldn't commit crimes, they now begin to commit crimes out of necessity to eat. And that's, I've been involved in a number of food bank drives, and we've organized pantries through a couple of organizations that I belong to, and it's the generosity of people, and I can only speak to Putnam County, is amazing. It's just amazing. You really, it melts your heart, because people really do care about other people, and unfortunately, it takes something like this to bring it out, but it's coming out. And it's out. It's been out for a while now. And then, conversely, you have the other side where people get, some people get dumb. But
Yep.
I think the greater magnitude is on the generosity and the desire to help other people.
Right. And the other thing too is, and it's a positive. You have to, at this point, we have to try to look at the future a little bit. And one of the positive thing is, like, a lot of the farmers upstate now, they donate to these food banks because they had no drivers. That a lot of these places are donating within their community, and that's a great thing to do. I mean, and it just goes to show that we can, when we all can work together. And again, too, there are the bad things that happen with it, and we want to move forward. Everybody wants to reopen, but we all have to also realize the reality of what's going to happen. There was a thing in New Jersey where, because they open the beaches and they don't open the restrooms, so I mean, things like that are going to happen, and that's what's really a shame. That's what's going to set everything back.
Yeah, it's
Yes.
So I live in Brooklyn, Chief. I'm reporting to you from the hotbed of COVID-ness in the world, it seems. My wife was practically retired as a nurse, maybe working 2 days a month in an endoscopy unit. Nice. It's like a nice
Yes.
detail for a nurse, right?
Yes. Yeah.
And she went back and became a full-time COVID ICU nurse for about 3 weeks. And then that came to an end. It was like a tidal wave of COVID cases here in Brooklyn. It was amazing. All you heard all night and all day was ambulances. Every hospital just became a giant COVID ICU unit. This COVID, for our viewers and listeners who aren't in the New York City area, if it hasn't hit your community like a tidal wave, I really pray that it never does, because it hit New York City like a tidal wave, and it was scary. I think yesterday they updated the New York City death total to over 20,000 from this, and the CDC has weighed in, and they think that number is actually a little low. So pretty scary stuff. I'm a little concerned about when we open up, frankly. For myself personally, I'm a retired police officer. I don't know if I'm going to go sit in a crowded restaurant, if I'm going to get on a crowded airplane. I just don't know if I'm going to do it. Our cops, they don't have a choice. Cops don't have a choice. They get that job. They have to go and interact with people. They've got to enter locations, crowded or not. People are masked or not. It doesn't matter. They don't get a choice. When I was on a job and if you were off duty or at a family gathering and you would tell like a war story about something that happened to you at the job, invariably someone would always say to me, "Oh, you're so brave." And I'd be like, "No, I had to do that. That was my job." 911, someone called 911, the radio dispatcher sent me to the place. I'm like the last person in the line. I can't get off the conga line. I have to go do whatever I have to do. Now I don't.
Yeah, you just did it.
I can call 911 and some on-duty guy shows up, right? Some young guy who's not fat and old like I am. The point, our poor cops, as things open up and the virus spreads, more of our cops are going to be exposed to the virus. And
I agree with
like,
you.
Yeah.
I'm sorry to interrupt you, but I think that that administratively and out of practicality, law enforcement's hands were tied. They weren't properly educated and trained and funded for this pandemic. They were very slow to address that. I think EMS, out of all the first responders, I think EMS may have had a little bit of a heads up because they're gloving up and they're masking, on the normal kid. And what does law enforcement do? We just go in there, grab, touch, move, pick up, whatever it is we have to do. As you just said, hey, we're the ones. We got the call. There's nobody behind us except more cops, but we have to do that particular job.
Yeah, it's scary stuff. I don't know if we'll have a vaccine anytime soon. Vaccines are hard to develop, but maybe they can come up with a treatment that kind of takes death off the table, right?
Yeah.
If I think I'll get COVID and get sick, I can roll with that, and maybe I will get on an airplane, get on a subway car, go into Manhattan, do those things, go to a ball game if they ever do come back, right? I don't know if without treatment, if I'd be willing to do that stuff. I want to give a little shout out here real quick to my old radio car partner, Mike Sasek. Mike is out there in Babylon, Long Island. He spent 38 days in Stony Brook Hospital and 18 days on a ventilator. He survived COVID. He's home now recovering. It beat the living crap out of him. But he's a tough guy and he's a fighter and he's gonna come back. His wife's a retired cop, Suffolk County chief. and his daughter is a Port Authority cop, and so they're a blue family. And I just want to give a shout out to my old partner Mike. I lived and died with that guy, and I'm glad that we'll be able to tell our don't be war stories again someday. So,
sorry, he's doing well.
Thank you.
What was I going to say? Oh, with the reopening, I mean, they were saying that now, even restaurants, you have to make it, nobody wants to go to a restaurant where they're serving you with like rubber gloves and like even the dinnerware and the cooks. And it's like, for that matter, I mean, that's not an enjoyable thing. And, there's certain, it's like, you're always going to get the person that sits in, especially I'm shorter, somebody always taller sits in front of me invariably. Now, I don't say anything.
I'm sorry, Michelle.
I sit there and I just, it's no big deal. But, you see people that they get heated over things. And even like with the mask stuff, put your mask, it's us policing us, and that's great. But, you can enforce it to a degree. You can make a very strong suggestion, but putting your hands on these people isn't really the way to go,
Right. They've put law enforcement in a very precarious situation, enforcing, social distancing.
Right.
And it was a decision made immediately, and like good cops do, all the men and women of every PD went out and started, hey, do this, you're not supposed to do that, where's your mask? and they, the confrontations, the interactions became physical, and then they became violent, and then there's complaints of police brutality, and then 2 and 3 and 4 and 5 years from now, you'll see all these lawsuits. It's spawned, a cottage industry for attorneys. I mean, nothing against attorneys, but
Oh yeah, Jacoby and Myers are like, they're just salivating right now. They're making the commercials. They're starting already. They have the guy in the hospital bed, like, just sign this.
right.
Don't worry about it. You look good, But what do you think? What do you think about our governor? How you think Andrew is? How you think he's handling New York State?
Honestly, I think he was slow to organize and construct a plan. I think that listen, the guy couldn't wait to get on TV and just talk. And I mean, some of the stuff he's talking about, hour and 15-minute press conference about things. And the thing that really perturbed me, made me angry, was, protecting his mother. God bless him for that. But what about those people in the nursing homes? I worked in healthcare for 12 years after I retired, and I was fascinated that he was forcing the healthcare, nursing homes to take back patients that tested positive. And that's the petri dish for breeding grounds for, infecting the whole place. And that's essentially what happened. And the worst part is he put a lot of workers and staff unnecessarily and needlessly in harm's way, and they contracted COVID.
I find it fascinating that New York State has more deaths than almost every nation on the planet Earth, and yet the governor is like a hero. Yeah. It's unbelievable. It absolutely boggles my mind. Well, they should do college courses about him years from now, about how to market yourself in a crisis, because he's coming out looking great.
Yeah, but you want to know something? If it wasn't for him, a lot of this stuff wouldn't get done. And you got to look at overall leadership. You have a leader that's refusing and saying, don't wear masks, and I'm not going to wear a mask. That's not what you say to the general public, because there's people that are, there's people that have common sense, and then there's true believers, and they're like, I'm not going to wear one either. And that's where those fringe people come in. So as a public official, you know what? I think he took the reins pretty good, because honestly, first of all, he does talk about his family a lot, and it does get annoying. I agree. But he does limit his press conferences. There's press conferences that go on, and it's and babbling, right. And all of them do that. Like in the beginning, I understand, even like de Blasio's press conferences. Dude, just tell us what the deal is. Like, you have to dummy it down. I don't want to hear about another organization that's going to let us know if we can go to the beach on Memorial Day, or this summer, I should say.
You can't go to the beach Memorial Day. That's a company rule. Producer Pam said you can't go to the beach.
Don't forget, de Blasio is still waiting for somebody to tell him what to say.
Yeah.
No, yeah. Cuomo's done, you know what he did? You're right. He showed leadership by stepping up to the podium and providing information and direction. I think one of the biggest problems was some of his press conferences that I saw, and I don't know that if I can attribute it to him, but some of the information was so dire. But there's a way to deliver that message. I mean, I think, and that's why you have the toilet paper craze and the disinfectant wipes. The messaging by everybody on that should have been a little bit more organized, and that's a failure of leadership to do that. Yes, you have a bad message you have to tell them that, and then tell them, listen, we'll get through this. There was at many points in time during the apex of this thing, which I think we're through. I'm not a medical professional, so don't quote me, but there wasn't that message of hope, that glimmer of sunlight anywhere. It was just too much negativity, and look what's happened. Overdoses are up 50%. And you're gonna. I mean, the other.
I'm glad you mentioned. overdoses, I was wondering, I never used Narcan. I retired before Narcan was given to police officers. It was always something that only the ambulance crews carried. But a lot of Narcan is given nasally, a pump into the nose. And I'm a little concerned for our cops out there, especially in those parts of the nation that are really crushed by opioid addiction. And there's a lot of them in New York City. Staten Island is always been crushed with it. Are they exposed to COVID when they do that little pump? Is there I don't know enough about the engineering of how air moves inside your nose, but when you blast something into the nose, does something come out like a reverb almost? And does it put our cops in danger?
I think what they do now, actually, it was in, there's directives and suggestions. And they even said like EMS, as far as giving somebody, resuscitation at this stage of the game. So those are decisions I think that they have to make that are very challenging given, the circumstances. They might suspend certain things. They might, um, that's a problem. They might, nobody gives mouth to mouth anymore, right? They have the thing, the puffer, and even that you get close to it. How in Putnam County are they handling? How do you feel that they're handling this whole COVID situation, the police situation in Putnam County?
I think in general, from the elected officials, it's been handled well. Our county exec, Mary Ellen Odell, has done a fantastic job. She puts all the relevant information out on a daily basis. She publishes informational updates from the Department of Health at the county level as well as the state. The legislature has worked very, very well with her. Politics seems to have taken a back seat for the most part. And her information has been good and valid. Our doctor, our commissioner of health, Dr. Mike Nashalot, has done a fantastic job. That poor guy is probably working 23 hours a day, trying to keep the data fresh and implement the treatment plans that are being recommended by CDC and the feds. I think on whole, they've done a good job. In the community where I live, we get a lot of hikers up on the weekends.
Mm-hmm.
So there was a brouhaha about that. They were coming up. They weren't wearing masks, and which is one thing. And it's state property. So the state was very slow to implement the closing of the parks and the trailheads,
Mm-hmm.
Which I added to it. And then there was a parking issue. And I see it today. Where I live, you get people parking on the street that don't live there so they can go hiking. They take off for 3 or 4
Mm-hmm.
hours. And they're not wearing masks. And that's okay when you get out of the car and it's one of you or two of you,
Yeah.
But as soon as you start getting around people, you're on a trail that, it's not 20 feet wide. It's,
Mm-hmm.
maybe 8 to 10 inches wide, and people
Yeah.
there's no lack of common sense with respect to that. But the county in general, we have one hospital. It's in the eastern side of the Putnam County. It's in the county seat, and they've done a very good job. They've had Putnam County in general, I think, has had about 1,245 cases with about 55 deaths. Any death is bad, but when you do if you're looking just at numbers, they're addressing it. They use 211 up here for informational materials. I know that was getting in the area of about 900 calls since the beginning of this. So there are a lot of calls about it. The 911 calls have decreased, and people are, starting to get their feet under them and say, I have a question about it, I need information. The state we did one drive-through testing site.
Mm-hmm.
Went very well. It was heavily utilized. We probably could have used one or maybe two more based on what I saw in comments from people and other professionals I spoke to. But the state felt that they had enough in adjacent areas. And again, those are difficult to staff and design and equip. So I'm sure that all those factors played into it. God forbid we ever see another pandemic. I'm sure that, we should all learn from this. It's not the time to
Right.
point fingers and blame
Mhm.
people. We need to learn from it and say, hey, not if, but when the next one hits, we're going to do this, we're going to do that.
Right. That's the thing that people, that's exactly it. Like it wasn't perfect beforehand, so maybe we can make it, a little bit better now. I mean, and again too, all these things like playing Monday morning quarterback. A lot of times too, it's very easy to nitpick, but this is really like a very unprecedented thing. And you have an equal amount of people that they do want to get the economy going, but they're also like restaurants. I mean, they want to get the economy going. Like there's certain things though that they're willing to do and not willing to do, especially you see what happens. Like in California, they had, too many people on the beach, and that's what happens. And that's how you can understand why they don't want to react and close things, because they want to say, hey, let the people get out. But by the same token, then you have people like out on Long Island, the boardwalk at Long Beach is closed because it's not that wide, you know. And I mean, it's just like we have a lot of like town parks here too, and that I think is the other thing that makes New York State very difficult, is because there's such a wide variety. You have all the way up in Sullivan County, which is probably gonna reopen soon, say, and but down in Long Island, we're not going to open for a bit. I know New York City isn't. The only good thing, and they made themselves very clear, all these governors, they said, they expect, like, I said, I'll go upstate and buy eggs and milk. That'd be great to get out of the car for a few, get out of you know what I mean? And you're supporting, but then by the same token, I don't want to, infect anybody. But it also, too, everybody has to do their part. And the big thing I think is we really have to all come together, support local businesses, go and buy coffee or something at the bagel place,
Tip
maybe.
big.
Yeah. Or if
Don't
you
be,
order out,
don't
like,
be a
yeah,
cheapskate with the tip for that delivery guy. Come on, buck
that's
up.
right. I've done a DoorDash or two in my day. And you know what, when you need a pint of ice cream, come on,
Right.
reach into your pocket.
We've done that here locally. We've tried
Yeah.
to, patronize as many of the places that have takeout orders. And some of them, to their credit, they've adopted and they're selling things
Mm.
that they may not necessarily sell, vegetables, fruits that they're able to access. So that's been helpful. I just found out yesterday there's a local restaurant, Italian restaurant, went out of business in my town. And then another one about 25 minutes from here is closing. They just can't sustain themselves. And that's, it really, it hurts to hear that, because that's what we're all about. We're about opportunities and trying to stake a claim in a business and put, a product forth that people will purchase. And we have to remember that, a lot of people, when this first hit, they were running to all the grocery stores, purchasing, not one can, not two cans, but 25 cans of this and so many packs. Don't overreact. We cause our own crisis doing that. And unintentionally, we put other people out of business. We harm our local community. And we need to do that. And Jerry, to your point, it's really important that you tip well, because, that money's going to people. They need help.
Right. Right. Especially us retirees who have a pension check coming in. Right. Exactly. I have an important question for you, Chief. I actually got two questions for you. First is Putnam County upstate?
Depends on who you ask.
I'm from Brooklyn, so it's upstate to me.
Hey, it's upstate to me too, but not the guys that you work with when you work in the Bronx.
Yeah.
And number two, I guess while we got you on here, Michelle mentioned it earlier. You're running for sheriff in Putnam County. You want to return to law enforcement. You want to lead an agency that does both patrol and runs the jail in Putnam County. What do you want to do for Putnam County? Speak to the people of Putnam County, your voters.
I want to bring my experience and my knowledge and my ability to organize and manage a law enforcement agency to Putnam County. I was fortunate. I spent nearly 30 years in law enforcement. My brother retired as a first sergeant with the New York State Police. My father was involved in this community where we live for his entire life. He lived to be 95, but he was involved personally and hands-on for 46 years of that. And he owned a business. And as kids growing up, we all worked at his business and we learned what's entailed in that. And if you run any organization, any business, whether it's law enforcement or a hardware store, as if you own it and you're responsible, your name means something, regardless what the name of the entity is. If you try to do the right thing for people all the time, you'll be successful. And I want to bring that to Putnam County. I want them to feel that they're getting professional law enforcement services at a reasonable price. No additional costs. We're not going to do anything other than what the community needs. And if they want something, then we'll figure out a way to get that done. We're going to put together a really good command staff, and we're going to change, in a positive light, we're going to change the way we interact with people. And I'm not saying that they don't interact positively now, but we just want to modify that and adapt. And then really what's important is I want to talk to the men and women of law enforcement of that agency and find out what's working, what isn't, why, and then improve upon all of that. And if something's not working, we're going to figure out a way to get it done. And it'll be done collectively in collaboration with them as much as we can do that, and just interact with our communities. Find out each community, there's 6 communities, 6 towns in Putnam County. Each one of them needs a different style of law enforcement, a policing service. And we want to provide that for that community. It's, we don't have just plumbers or just carpenters. So when you get called to an incident or a scene, you got to be able to do a lot of things. You're multitasking, maybe a little bit more than in the confines of the city. But, because your backup is an additional 10 or 15 minutes away, depending on a number of circumstances. So we want to improve the ability of that uniformed deputy or investigator to provide that service.
And you think policing has to change now after this this pandemic. So why do you think some of the changes, that they might have to implement?
Well, I think you're going to be dealing with a completely different society, because society and the work structure, and it sounds like potentially even the educational systems, but our whole culture is going to evolve as a result of this. I think there'll be more people working at home. There'll be less, hopefully less traffic on the roads, so that people can get in and out of the city in a reasonable amount of time. So law enforcement has to be cognizant of that. They have to anticipate changes. They have to prepare for that. And their policies and practices have to be flexible to evolve with that change, to adapt to that change. How you interact with people is going to be a big part of that. You'll see some people, as I walk through my community, I see some people and they'll stand 2 feet away from me, and others won't get within 10 feet. You're walking on the sidewalk, guy crosses the street. So you have, it's kind of, remember back in the 80s when Castro led all the Cuban refugees? They came to New York, and they constantly stared down anytime you were talking to them. They wouldn't look you in the eyes. And law enforcement was taken back by that. We were like, hey, I'm talking to you. I want you to look at me. I'm trying to communicate to you. Even though the language barrier has always been a problem, but just normal hand gestures and nonverbal communication skills. So I think all that's going to evolve too. We have to understand that.
Right. Exactly.
Hey,
So
Chief,
that I want to be at the forefront of that.
Going back to your old location, the MTA police, they have a big portfolio of stuff that they have to protect. They go through, 11 counties or something like that in lower New York State. I used to work with the MTA cops a lot. I was a Midtown South cop at the NYPD, so even pre-merge, I worked with the LIRR cops at Penn Station and the Metro North cops at Grand Central Terminal. How do you think policing for those cops specifically and commuting is going to change with all this?
Well, first of all, I want to recognize the work that the men and women of the MTAPD have done and continue to do. Outstanding job. They truly are a group of professionals. They've persevered through a number of different situations dating back to 93 with the first World Trade Center bombing, and then through 9/11, and then through London and Madrid, and through a couple of different situations, similar but not as bad as this one, SARS and MERS, and now the COVID-19 stuff. It'll change, I believe, for them as well. I think it's going to change for every law enforcement agency because people are going to be a little bit more standoffish. You're not going to be able to get as close and in, and maybe tactically, that's a benefit because, you know, we've always taught to keep our distance, so that may be helpful. But in terms of the transportation system in and of itself, it's drastically changed now. You know, there are less trains that are running. I think some of the bus lines in the boroughs have been reduced, you know, the number of trips per hour and stuff, because it's impacted everybody's workforce. We don't have the staffing to do it. And you know what? I don't know if anybody really knows how it's going to come back. Is it going to come, you know, are we going to flip a switch like it was, you know, 136 days ago? And we're going to be okay? Or is it a whole new process? I don't know that we'll know until we get into it. And then we'll be dealing with all the little nuances of that as it recovers. So, you know, I think one of the big things law enforcement has to look at is see how we deal with defendants, people we're arresting. What precautions are we going to change? How we're going to, you know, how are we going to modify that or anything else, whatever type situations that those are going to require, and modifications to our policies and practices with respect to an individual that tells you, no, I'm fine, or it's hacking his or her lungs out. Because either way today, it appears that you don't know. There's no, you know, red light bulb that goes on and say, hey, this person's dangerous.
Right. And I mean, and the one thing too that I was impressed with was, you know, my niece had to go to the NYPD Academy, right? And then when she graduated, she had to go to the MTA Academy, and they had it wherever it was. And I said, oh, what do you have to wear? And she goes, khakis and a polo shirt. And I was like, that is so cool, because you're treated like an adult there because they're able to treat you like an adult there. So their officers are, you know, I see, because I know quite a few of them, you know, I see how they interact with people. You know, they are trained much differently. And, you know, it's good because it is a smaller department and they're able to do that. They are able to focus on that specifically. And they really are the face of many commuters. They're the first people that they see. They don't see, you know, an NYPD cop really for a bit until they, you know, they walk into Penn Station or Grand Central. So they really are, you know, a big part of the whole situation. And now they have the Barclays Center as well. So it's not just Grand Central and Penn. Now you have Brooklyn. So they are also affected in a much greater way, you know, going from the city out to wherever they live. As far as like the number of people, is Putnam County going to be larger than when you were the chief of the MTA as far as governing it or sheriffing it, policing it?
No. Under the MTA, we had 800 personnel. Putnam County Sheriff's Department has about 170, and that includes road patrol and the correctional division. So it'll be a little less. My budget with the MTA was over $100 million. The budget with the Sheriff's Department is a little over $25 million. So that administrative experience and hopefully knowledge that I have, I'll bring that to the community, to the county, and hopefully we can do some very good things with that.
800 is a lot of cops. That's
Yeah, it was good. We had the largest, and we still do, I believe, canine unit on the Eastern Seaboard. We had 50 canine.
so you have a MTA police have a canine named after that guy
Yeah.
right there, Tony
Yes,
Dwyer.
yes.
Yeah,
We have a bunch.
and that's appreciated. Thank you.
One of my friends, who's a canine cop with the MTA, she has Artie is the canine dog. He was the Nassau cop that got killed over on the border of
Right.
Queens. There was a robbery, a
Oh, the
gas
Cross
station
Island
robbery.
Parkway.
So
Yeah.
she has Artie. And the funny thing is that Artie doesn't go out on patrol with her during this whole thing. Artie's home because she's, now they move them into the subways and stuff. What do you think
Right.
about that? Actually, I think I have to honestly say, why does the subway have to run 24 hours with this guy so this guy can sleep on it? I think this is a very good idea. I have to say, I
No,
like it. What do you think,
no, you
Chief?
live on Long Island. I'm going to have to weigh in here, Chief. As the guy on the screen for our viewers who lives in the city, you have to have 24-hour subway service. You have to have it. And it's the city that
No
doesn't
way.
sleep. Frank Sinatra sang about it, for crying out loud. You close the subway, you might as well never listen to that song again.
It's ridiculous.
Does that mean they can't
That's
play
why
at
I jumped
Yankee
the
Stadium?
turnstile, because I'm not paying for the homeless guy to sleep on it. Now I'll actually pay a fare to get on that subway because it's nice and clean. Chief, can you please weigh in
So
on
I'll
this?
tell you that.
Yeah, let me say this. I was shocked when Governor Cuomo announced that he was going to put the MTA into the subway, and 500 is a good start, but it's not going to do it. We're not going to take over the whole subway. Listen, I think the genesis for this problem is the inability of the governor and the mayor to get along, or to have personality conflicts or political conflicts for whatever reasons. But we've always, listen, NYPD and MTAPD and the Port Authority and New Jersey Transit, we've always worked hand in hand. The relationship and the collaboration on so many things has been unbelievable. I know that NYPD used to bring their canine teams. They used to train with us a little bit. We sent teams to their training site. We just built, a couple of years ago, we built a $10 or $12 million canine training facility in Dutchess County, accessible to some of the interstate and some of the major highways up here. And we were able to get rail cars and put stuff there that they're going to interact on. It's a different environment. So other similarity between rail, going into the transit system is going to require additional training, communication issues.
Yeah.
Although I know with the new super radio system that's going in, it's T25, I believe, that should benefit everybody. That should remedy some of the issues. But I'm excited for it because it allows us to increase our training portfolio, and it lets the men and women of the MTAPD shine.
Yes. It's nice to, they actually do. I know a few of them. It is a much different rail system. Like when they merged the NYPD, they sent us to track training, and you had to stand in the little cubby hole thingies of when a train went by. Like, I'm not doing that. My radio doesn't even work up on the street. I'm not going down in the hole, standing in between. I'll turn the light off. You know what I mean? That's the easiest thing. But it is much, much different. So, like, honestly, it's like if I get stopped, if I was late on the way to work because somebody had an accident and they had to close the highway down, I get pissed and I'd close the hutch down because highway wouldn't respond. And then as soon as you said, I'm going to have to close up, all of a sudden they all came down. But it's just, I think it's just a great, it's big and everything. And it is a totally different system, a much totally different system. And you're right, people don't realize that. It's a larger,
more diverse system.
Yes.
I did
And,
2 years
Yeah.
I
after
didn't
the
answer-
merge. I'm sorry, Chief. Go to you.
I was just going to say, I didn't answer your question about whether or not they should close it. I think the jury's still out on that. I think they've got to come up with a very robust and methodical process to clean the subways. I took last time I was in the city, I think it was January or February, I took the subway and I was flat out amazed at the ownership claims that the homeless had staked down there. And that's a failure.
Yeah.
That's a failure of government. That's mental health stuff. And that's a failure of the
Yeah.
government to address that. And these people need to be in a controlled environment where they can receive treatment and provided, with healthcare and treatments and cut them on the loose, letting them like on cardboard boxes on Park Avenue or Queens Village. It's not helping them. We're not doing anybody any favors with that.
Right. And right now too, I know every year around this time is they all come to St. Mark's Place in the Village because it starts to get warm out and it gets bad. You have these young kids camping out there, and then usually around July they start to move them. But it's like when in this day and age, especially with everything going on, we all have to be careful. And with that being said, Chief, I want to thank you for being our guest here on the weekly roundup, and good luck to you in your bid for sheriff for Putnam County. I hope you win. I can't vote for you because I'm on Long Island, but I would if I could.
Thank you.
Anything else, Sergeant Jerry?
No, Chief, good luck. Hope next time we speak, we're calling you Sheriff instead of Chief. And thank you for wanting to give back some more. A lot of guys can retire and go get those consulting gigs and make a lot of money. It's probably not the highest paying job in the world, but it just shows your commitment to public service, and that's appreciated. For my partner, Michelle Durante, the former Narco Ranger from Boogie Down Bronx, and myself, Sergeant Jerry Kane, thank you for watching us on the Weekly Roundup on Inside Blue 360.